Hello to all. This is a recording of a live webinar with the content captured on the 24th of March 2021. I'm pleased to introduce Darish Attar, who's going to take us through the presentation sponsored by Trudell Medical UK Limited.
All right, so just to introduce myself, thanks Adam for welcoming me this evening. And just to say, I'm a respiratory lead pharmacist based over in Barnet, the Barnet area, which is in north central London. I've been involved in respiratory care for a number of years, community pharmacist since when I qualified and still am. I still locum. I also work within GP practice as an independent prescriber too. But just to say that tonight's topic is around inhaler devices, and in particular we're going to talk about spacer devices. A lot of the work I've been doing as well since 2014 in particular in north central London in the Barnet area is around improving and optimizing inhaler technique, and we've been involving GP practices and community pharmacies working collaboratively. Something you're going to hear a lot about is the green agenda, and you may have heard of this hashtag no waste, no harm. One thing we want to really focus on is making sure that we're not harming our patients with over prescribing, for example, of certain medicines. And we want to make sure that there's little waste as well. So the world of inhalers, there's a lot of talk around that at the moment, and you'll become probably more and more aware of that. So these are some of my disclosures. So I'm doing this, I've been invited by Trudell to do this talk tonight, but I do a lot of talks for a lot of different companies. And we need to definitely work with lots of different companies because we need placebos in our community pharmacies to show patients, their devices. So just as a way of introduction as well, I thought just to give you an idea of what happened back in March of 2020. We don't want to go back there again, but a lot of you will be aware of the rapid increase of inhaled treatments. So a lot of metered dose inhalers, dry powder inhalers being prescribed, whether they're preventers or relievers in asthma, and a lot of COPD inhalers being prescribed. A lot more people being conscious, I guess, of their lung health, which was a good thing. But what I would say is that when this was happening, we needed to work. So this was my role within the CCG. We needed to work really closely with the local pharmaceutical committee. That was vital because the community pharmacies were telling us about the stock shortages that were taking place, and that collaboration was absolutely key. But one of the things we did find out, and this was sort of months later, was worryingly the amount of spacers being prescribed hadn't gone up alongside all the inhaled treatments, which was a really worrying sign because it's very hard. It's very hard to use a metered dose inhaler by itself or a puffer by itself. And if you haven't got it with a spacer, then how is that person going to get that medicine to their lungs? So that was a really, really worrying sign, and hence why tonight's event has been organised around what more can we do in community pharmacy to support our patients. So just to give you an overview of the things we're going to talk about, it's reminding ourselves of the common errors that can take place when using inhalers, why spacers, and an overview of this spacer awareness campaign. We're talking about as little as 60 seconds to raise awareness, and I'll talk you through how that can look. And then we can also talk through other options around how 2 minutes, for example, you could bolt on a little bit more, and how if there was the time, then we could look at longer approaches as well. So we're thinking about our Spacer Guardian pledge that we'll focus on. And then there are differences between spaces, so just some important awareness around that. So if you look at some of the studies, and I'm sure, I mean, I've been a CPP tutor as well for many years as well, and did the advanced inhaler training. This was back in 2014. And one of the things that really stuck out in my mind was the statistic around and that study that happened a number of years back in 2010, but it still sticks in my mind and still spoken about a lot, was the Baverstock study that looked at 150 healthcare professionals, and this included pharmacists as well as nurses, respiratory consultants, GPs, etc. And they found when it came to using a metered dose inhaler, the 7 steps to good inhaler technique, what they found in that particular study was around 9 out of 10 of us healthcare professionals would make a mistake, at least one mistake when it came to the 7 steps to good inhaler technique. Now, when we look at patients, it's not that much better, as you can see on the far left, and this is looking at Henry Christian's study that was published in Nature, and we can see the difference that a spacer would add when it comes to reducing the number of potential errors. And you can see why it's difficult. It's not going to be easy to use a metered dose inhaler when you've got something that's coming out so fast. So one of the things that we need to encourage patients, of course, is going through those 7 steps, coaching a patient, watching a patient, and also sticking our hands up and highlighting that it's not easy to use one of these devices. And this is why one of the things I do is stick up my hands. And actually, when I speak to patients, I do stick my hands up and say, believe it or not, 9 out of 10 of us healthcare professionals may make a mistake when using one of these inhalers. I never ever ask a person, do you know how to use your inhaler? That question always gives you the answer pretty much, yeah, I know how to use my inhaler. And it kind of ends the conversation. So I always find a good way to introduce this in the community pharmacy when I'm locuming in one is always to be honest and open and just say, believe it or not, 9 out of 10 of us may make a mistake. And this is why we're offering a coaching service within the community pharmacy. I know your nurse may have shown you, or your doctor or your pharmacist may have shown you, but this is a great offering that we can do. But specifically about spacers, if we think about the metered dose inhaler, we're thinking about the propellant and the active drug coming out of that metered dose inhaler. Think about the actual velocity or the speed that's coming out at. And you can see why patients will make mistakes, because if that's coming out fast, you may find there's this urgency for the patient to inhale fast as well, because they'll be in a rush, thinking I've got to actuate and coordinate all of this really correctly. So what the spacer does, and you have different types of spacers, so you might have something like a valved holding chamber, which is called a VHC. That allows the person to get the medicine to their lungs, and it slows that person down. So there are advantages, because what you'll find is the length between the mouthpiece of the metered dose inhaler is further away, and it gives the person an opportunity to get the medicine around the bend, which is really important. So there are lots of papers out there around the importance of spacer devices. And looking at this paper, this headline, it talks about even with optimal inhaler technique with these modern inhalers, if you can get approximately 20% of the drug to your lower airways, this is just a metered dose inhaler by itself, you're doing good. But if you've got suboptimal inhaler technique, then a lot of that medicine will actually be lost, and you'll end up having this oropharynx absorption. A lot of it will be swallowed as well. So a key advantage of the spacer device, it does slow the person down, because when you're inhaling slow and steady, you're inhaling over 4 to 5 seconds. You're obviously going to be breathing out first. It gives that person an opportunity just to relax and calm down and not do it in such a rush, because as we've seen with many people that use a metered dose inhaler by itself, a lot of it gets lost from the side of the mouth, or they haven't emptied their lungs out fully, and that coordination is a real problem. So the good thing as well with the spacer is a lot of the particles that are coming out, any of the larger particles will be lost in the spacer device. It will get caught on the sides, and the spacer device will allow more fine particle fraction, which will improve lung deposition as well. So there are a few advantages. Patients may also find that they're not tasting the medicine as much as well, and you may get less side effects like oral thrush or hoarseness of the voice, which is a lot of people complain about that when using inhaled corticosteroids, for example. So the European Respiratory Society, they talked a lot about the importance of using a spacer or valve holding chamber properly, and for regular preventive therapy, and using it as well for like a salbutamol in an emergency situation. So just to give an overview of the actual pledge and the Spacer Guardian pledge, this whole pilot, I'm going to just give you a snapshot of some of the materials, and the 10-minute video that Adam is going to share with you as well is something that you can has got a role play in there around how it's done in 60 seconds, and also how it's done in 2 to 5 minutes if you did have that little bit of extra time, because it doesn't take long for us to really make a difference, just like it doesn't take us long to do very brief advice on smoking, for example. So we need to be alert and refer. So this is just some of the material that we've put together. And this has been with the help of Trudel. So a lot of this work I did myself with some of the colleagues from Trudel. And what we wanted to imagine is us in the community pharmacy, what actually happens. We get a prescription from a patient. If we notice that it's a metered dose inhaler by itself, then that should sort of flag in our minds that I wonder if this person has got a spacer. So it could be that the counter assistant or the health champion, or it could be if it's an electronic prescription, we've picked it up, we can always approach the patient about this. So first question that would come out in my mind would be if a person's got a prescription for a metered dose inhaler, is you know, have you had a spacer with this? Or I'd look on the records. I've noticed on your records you've been given this inhaler alone. Has anyone ever spoken to you about a spacer? Or if you've noticed that the spacer hasn't been changed in the last, if it's really old, the spacer should be changed every 6 to 12 months is the advice. That could also be us, because the medication may be less effective if the spacer is not properly maintained, so that's really important. So the two things that I'm going to just give you a top line on is the spacer opinion questionnaire, I'll call it SPOC, and also the patient information leaflet, but we call it SPIL, the spacer patient information leaflet. So the SPOC and the SPIL. And we've also got some conversation starters that can help when it comes to that 30 to 60 second conversation. We've also got a checklist of what that 30 to 60 seconds could look like, the questions we ask, which we've just touched on, which will be along the lines of, have you got a spacer? If no, then we ask the patient to fill out this spacer opinion form. And if they have got a spacer, again, they can fill out that spacer opinion questionnaire, the SPOC. And whilst they're waiting for their prescription to get ready, they can also have a read of the patient information leaflet, or we call it the spacer patient information leaflet or spill. So this, if you feel that the patient needs and they're happy to have a spacer device after they've read the spacer patient information leaflet, which I'm going to show you shortly, then a short-term referral form may be a good option. So these are the 5 questions on the spot whilst they're waiting for a prescription. So part 1 would be, if a person has, do you have a spacer device with your prescribed metered dose inhaler, or sometimes known as a puffer? If they say no, then basically just give them the information leaflet I'm going to show you next whilst they're waiting for their prescription. And if they do have a spacer, then whilst they're waiting for their prescription, they could answer these 5 questions. And really the 5 questions are around, first of all, why a spacer? So using a spacer with my puffer will make it easier to get more of my medicine to my lungs than using a metered dose inhaler alone. So that just gets them, the way they're worded is very patient friendly, and of course would welcome any feedback from yourselves. And then using my puffer inhaler with a spacer right away, following the slow and steady breathing, will decrease taste of medication in my mouth and throat. It may also help reduce possible side effects. So that's really talking about the benefits of the spacer with reducing the side effects. And then the next 3 questions are really looking about the importance of changing your spacer every 12 months. And also if you've got any inhaler technique questions as well, and cleaning questions. So the patient information leaflet is literally what I'm going to be talking to you about for the next 5 minutes, really, which is the important features of the spacer and what it does. I've already spoken to you about some of the information, but again, it's really kept patient friendly. The pledge 2 actually is very much like the pledge 1, which is, do you have a spacer? And also, has it been changed in the last 12 months if they do have one? This next bit is around what can you do if you had 2 minutes to 5 minutes. And it's more along the lines of resources that we've provided with video links to Asthma UK. So educate the patient on the spacers, provide links to Asthma UK. So these are the different links to the inhaler spacer technique videos. So you'd have the single breath and hold technique, which is the most common technique that's taught without a mask. You may find a person's above the age of 5 and they actually been given a mask, but they don't need a mask. So that might be one of your referral letter recommendations, just to change the spacer device to without a mask. There's also people that do tidal breathing technique. And there's also people that need a mask or with no mask. So, and Asthma UK has got some really good videos around that. Now, the third pledge, which is something I'm not expecting anyone really to do unless you've got a real passion for this. And I think this is something that if somebody was given a new medicine, you know, like a new inhaled treatment, and they're also given a spacer, you could definitely spend the time with the person. I think for us, those of us, again, respiratory interested who want to know more about the 7 steps to good inhaler technique, then we should follow the UK Inhaler Group standards. We can give you again a link to all of that in the resource. We can, in the 10 minutes, again, teach the person about the differences between anti-static spacers and conventional spacers, which I'm going to touch on in a moment. And then just a general maintaining and caring for the spacer, single breath and hold, or with or without mask. And there's a checklist of the various things you can do. So if you go to the right side towards the bottom, you'll find that not the conversation starters, sorry, on the checklist, you've got things around questions you can ask patients. Ask if the patient usually uses a mask. Is the patient above the age of 5? Does the person, you know, about recycling? And also the key thing around inhalers as well is prescribing by brands and also checking that the medicine they've got has got a dose counter. These are the sort of things we could be looking out for. Now, with the actual spacer devices, just to talk about the different features, because there's a lot of publications out there just saying not all spacers are the same, and they are not interchangeable. What's nice about a valve holding chamber is that it allows the medication to stay in the actual spacer device. And so it's kind of got a one-way, you can do, when you're inhaling, the medicine could come out of it, but when you're breathing back into it, your breath doesn't go back into the spacer. So it's got a special valve that allows the air to escape around the side. So what you're finding as well with these modern spacers as well, if it's anti-static, then this allows, stops this static charge from attracting the drug on the sides. So be aware that there are differences between some of the spacers that are on the market these days. And just to highlight, the European Medicines Agency guidance talks about, again, for asthma patients who are well controlled, it's really important that they should always use the same type of spacer or valve holding chamber and not switch to a different spacer device, because it may affect the delivery of the amounts of drug. And even the global guidelines, we call these GINA guidelines for asthma, they're saying that the dose delivered may vary considerably between spacer to spacer. So that's really important to be aware of. So just to summarize around the bottom bit around actuation, if you're trying to do it without a spacer, you'll find people get it all wrong. They'll actually actuate, and then a lot of it will escape around the side of the mouth. And then, when you're trying to inhale, most of it's gone because it's escaped. The good thing around the spacer, it just slows you down and allows a person to inhale slow and steady. The Aero Chamber Plus FlowView, for example, is the one of the anti-static valve holding chambers. And it also tells you if you're breathing in too quickly, because it's got a whistle that goes off if you're breathing in too quickly. So that's a summary of the 60 seconds to make a real difference with the spacer opinion questionnaire. I hope you like the names. I'll call it the Spock and the Spill. They're the two main forms. Don't think of Star Trek, but the Spock form is the spacer opinion questionnaire, which is those 5 short questions that they can fill out. That should hopefully empower patients to understand the importance of optimizing their treatment and getting it to their lungs. The Spill, which is the patient information leaflet, is again a really nice patient-friendly questionnaire that they can use during the consultation. And those two, I think, working in parallel whilst you're getting the prescription ready, I think that will help generate a lot more interest in saying, why haven't I been given one of these spacers? Why have I been given a puffer metered dose inhaler by itself? Because ultimately, you're only ever going to need no more than 2 of these spacers a year, because they're normally changed every 6 months to maybe even 12 months. If it's well maintained, you can keep it for a year. And they're quite easy to, again, maintain as well, especially with, if you're doing the warm soapy water and allowing it to air dry with the non-static, with the static ones, and the anti-static ones, again, just refer to the manufacturer's leaflet on that one, because it doesn't necessarily need washing with warm soapy water and allowing it to air dry beforehand on some of them. And just these are just to sort of look at this particular brand, how it's got the one-way inspiratory valve. It's got a flow view indicator. I find it very useful if a person's using tidal breath with a child or with an adult, because you can see the indicator where it says number 4 on the picture. That goes back and forward, so you can actually see the person breathing in and out over 5 times. Also helps us to think about, as I said, the whistle going off, and just knowing that if it's anti-static, you don't have to prime it first time you're using it either. The metered dose inhaler, you do need to prime, of course, the first time you're ever using it. But normally some spacers, if they haven't been washed with warm soapy water, they need to be primed several times for it to form a coating on the inside of the spacer. But I don't want to overcomplicate this session, just in case you have some questions for me at this point. And hopefully a lot more of us can make a spacer pledge. It would have been nice to show the 10-minute video, but I know Adam's going to show that afterwards, because it shows the role play on how straightforward it can be done over 60 seconds, 30 to 60 seconds, and the 2 to 5 minute approach as well, just for us to raise awareness and make a real difference. And I'm like yourselves, I'm really passionate about obviously improving a breathless patient's lung health. And in an emergency situation as well, if someone's having an asthma emergency and they've got a meter dose inhaler without a spacer, how are they going to get that drug to their lungs if they haven't got optimal inhaler technique?
Well, thank you for that, Darish. I think that's really interesting, particularly as many areas, certainly Cheshire Merseyside, are starting to look at the green effects of inhalers. We're going to see some changes coming through. Many of you in community pharmacy are going to be doing new medicine service, or able to offer new medicine service, and the materials Darish presented, that can be really helpful as part of that, just to do it. We do have a couple of questions. We are running quite tight on time, so there's quite a large question in the chat, which some of my colleagues are going to take privately, because there's a lot in that. However, two that did come up, one in the chat and one in the Q&A. What the first one is, if you clean your spacer regularly, why do you ever need to change it?
Yeah, so I think with time, with the plastic, and I guess with the washing, like with anything, there's going to be wear and tear. So the British Thoracic Society have recommended the cleaning of the spacers at least monthly. A lot of the manufacturers recommend weekly cleaning of the spacers, and I think it's with all the tests that that the manufacturers have done, they've obviously seen a shelf life on their spacer devices.
Well, and one from Lisa: if a patient's unwilling to make an appointment with a GP, would you advise a pharmacy to sell one and explain how to use it, or what would your advice be?
Yeah, so I think with spacer devices, there are available to buy over the counter as well, but I think ultimately it's important that if a person is able to get it from the doctor as soon as possible, ideally at least possible. I'm not sure of the price over the counter, but of course £9.15, isn't it, these days for a prescription charge? It's just working out the differences between over the counter and prescription. But for me, I think if the person's up for buying it over the counter, and we can offer that extra value added service with regards to going through the 10-minute steps I was talking to you about. I think the 7 steps to using your metered dose inhaler plus spacer with the right style of breathing technique for them, and we're collaborating closely with the GP practice. That's key. I think the key part of any pilot like this is a really close networking with our practices to show exactly that we are not only the medicines experts, but we are the device experts too.
Brilliant. There's a few more questions in the chat. The documentation that Darish has put on the screen today, we're working with Trudel to provide all of the addresses for community pharmacies across Cheshire and Merseyside, and so those packs will be arriving with you directly over the next coming months. We're also getting copies of them, and we'll be hosting them on the LPC website, certainly on the CPCW one, and we'll make them available to all LPCs if they do wish to hold them. There are some more questions in there. We haven't got time for them tonight, unfortunately, because we've got a very packed agenda. So I think I'd just like to say thank you so much to Darish and to Trudel for providing this slot. And we'll make sure, as I say, it's hosted on YouTube, and if there's any questions on there, we'll pick them up from the comments and get them directed accordingly. This next section details the support that will be available through Trudel Pharmacy's pilot spacer scheme, and we're also going to have some example conversations.
Hello, my name is Darush, and I'm a pharmacist based over in Northwest London and also North Central London. Been a community pharmacist for many, many years. So during the COVID pandemic, of course, there's been a lot of work around trying to optimize people's inhaler technique, and even prior to the pandemic. But during this time, we've noticed an upsurge in people getting prescriptions for preventative treatments, which is great news. And some patients also getting reliever treatments too. But what we have noticed during this time is the amount of prescriptions for spacers has gone down a lot. And one of the things that we need to all be aware of is that inhaler technique is very, very difficult to do for us healthcare professionals and patients, especially when using a metered dose inhaler by itself. So if a person is using a metered dose inhaler, ideally that's with a spacer every time with optimal technique, and of course coaching by a skilled healthcare professional, including pharmacists, nurses and doctors, for example. So this project is very much, or pilot is very much looking at increased awareness, because pharmacists are very, very good at health promotion and making every contact count. As healthy living pharmacies, what we can do is engage patients who, for example, come in with prescriptions for metered dose inhalers, and we can identify if that person has got a spacer with that metered dose inhaler. So what's in the spacer pack? So one of the forms we've got initially is a checklist, a spacer checklist, which is really all the things we need to think about when it comes to making every contact count. Being that spacer guardian, the things where we can get the whole team involved as well. In the pack, we'll have what we call a spacer opinion questionnaire, which is something that once a prescription for a metered dose inhaler comes into the pharmacy, whilst the person is waiting for their prescription for their metered dose inhaler, the patient can fill out this very patient-friendly questionnaire, just 5 questions around their own current spacer use. Another item in the pack will be if a person does not have a spacer, whilst they're waiting for their metered dose inhaler prescription, they can read about the advantages of what a spacer will do, in addition to what the metered dose inhaler that they're on, either for their asthma or COPD. In the pack, we'll also have a letter just to highlight to the local practice to inform them that this is the pilot or project that's being involved in the community pharmacy, and how valuable our role is as community pharmacists as part of the extended primary care team. In the pack, we'll also include a little referral slip to inform the practice. Would be you're recommending basically that the patient should have a spacer with the metered dose inhaler, and the rationale why. So what we want to do is optimize the training and skills you have, and of course optimize the skills for the patient too, and keep it as simple as possible. The documents we have put together will give you simple explanations of what you can do to help the patient understand the importance of the spacer with the metered dose inhaler. And by doing the 60-second approach or the 2 to 5 minute approach, what you'll find is more GP practices hopefully will also value your skills and support that you can offer the patient. The patient will appreciate that you're looking out for them, and by doing that small intervention will lead to massive outcomes for that patient. One of the things we're all aware of is, of course, you've probably heard the expression antibiotic guardian, and there's this whole thing around us making a pledge of how we can make a difference. And for us to become spacer guardians, I think if we can make that pledge, 60 seconds, to make such a real difference to a person's life, and inhalers, optimal inhalers, does equal life for that person, that breathless patient, then what a great job, what a great deed we're doing. So what can you pledge to? Can you pledge to even 2 to 5 minutes if you have that time available in a community pharmacy? And that 2 to 5 minute pledge may end up leading to, and the 60-second pledge may end up leading to that person getting a prescription for a spacer Hi, Julia. I got your prescription ready for you.
Thank you.
And thanks for filling out that form. And I'm glad, I can see you filled out the part 1 that you haven't got a spacer. You've mentioned that you've got asthma there. That's fine. Today's date, that's fine. Okay, the patient information leaflet about the spacer form, did you manage to read that while we were waiting?
Yes, I did. It was very helpful. I think I need one.
Okay, well that sounds great, and believe it or not, I mean you can see the importance, but believe it or not, 9 out of 10 of us healthcare professionals may make a mistake when going through the 7 steps to good technique. So you can see why it's important. We'll do a referral slip for you to take to the practice to get a spacer.
Yeah, brilliant. Thank you.
Okay, thank you. Bye.
Bye.
Hi, Julia. So my name is Darush, and I'm one of the pharmacists based at the pharmacy here. I've just got your prescription ready for you, and it would be good just to go through the questionnaire you filled out. I can see you've done that. So it was just the one question. You've got asthma. Okay. I don't know whether you got a lot from that patient information leaflet, but what are your thoughts about the importance of a spacer with a metered dose inhaler?
Yeah, it looks really important. It looks like maybe I should have one.
Yeah, it's something that you're using your medicine morning and night, it seems, and it's something that you can use with your preventer treatment regularly, and also your emergency reliever inhaler as well. Believe it or not, 9 out of 10 of us healthcare professionals may make a mistake when using one of these inhalers by itself. And this spacer device will hopefully improve the amount of medicine that gets to your lungs and improve your lung condition as well, which would be a double bonus and minimize side effects, etc. But what would be good is if you're happy to take this referral form, or we can do it electronically ourselves, hopefully in the pharmacy, that this form will notify the prescriber to prescribe this. And once you're ready and happy, we can get that prescription ready for you and go through your spacer device. So we'll be able to go through the 7 steps of good inhaler technique, we call it. But before you go off and get your give this to the GP, what you can do is you can watch this inhaler video from Asthma UK, which shows you the normal technique that will be used by an adult as a sort of, we call it single breath and hold technique. So we can send that to you. You happy with that?
Yeah, can you send me a link, please?
I can indeed. We can do that electronically. So we have your details from the patient medication records. Is the contact details still the same?
Yes.
Okay, brilliant. So we'll arrange that for you. All right, nice to see you, Julia, and I look forward to seeing you next time, hopefully with your spacer device this time. So hopefully you got a good idea of how the making every contact count spacer guardian work how it can take place within the community pharmacy. It can take from 30 to 60 seconds. We showed one clip showing how short that was, or it could go to 2 to 5 minutes. The reason why you can go from 2 minutes to 5 minutes is if in the pharmacy, if we wanted to show and actually play the video from Asthma UK, and we have the link in your pack, so you'll have all that information to hand, you can show the patient the single breath and hold technique. And our role as part of shared decision making is to really fill in the gaps in knowledge and correct any misinformation. It's really about the patient being able to have an opportunity to ask questions, and maybe, if a person is prescribed a spacer, there's no guarantee that they're going to use it. So what we want to do is really get an idea of what's going on in that person's world and just find out, actually, is this a person who will make the most out of their inhaler and spacer? So when a person fills out the SPOT questionnaire, the spacer opinion questionnaire, we may get people disagreeing with some of the comments. Hopefully this shouldn't be a common occurrence, but if it does arise, it provides a really good opportunity to find out if maybe risky behaviours are occurring from the patient. And if obviously you do have time yourself and you have a specialist interest in respiratory yourselves, you may want to take this further with the patient yourselves too. This will be great for relationship building with our practices, as well as great for our patients, most importantly, because they can see what a valuable service we offer to them.